Hi, I'm Mary Ellen Hatch. I'm a rehab nurse. Better yet, I'm a rehab nurse who's running for board of directors position. I'm currently a member of the board of directors, and I would like to have a second term on the board of directors. I'll tell you a little bit about who I am and what I've done during my time with ARN. I've been a member for many, many years. I've been a rehab nurse for 27 years. Before that, I was in acute care, as many of you have been. While I've been with ARN, the things that I'm most proud of that I'd like to share with you is I was one of the people that helped develop the fellow program that have honored some of our most esteemed nurses within our organization. I have been on the awards committee. I have been on a conference planning committee. I have helped with lobbying in Washington, D.C. I've spoken at conference. I have done posters. I've also spoken at a couple of our other larger chapters and organizations. I've been around for a while and done lots of different things throughout the organization. So many of you have met me or seen me or had a good time with me at conference. So it's good to see everyone and get to be able to talk to you a little bit about running for office. One of the things I'd like to tell you a little bit more about is how I found rehab. I found it by accident. I was at my son's birthday party when he turned 7 and broke my ankle and was non-weight bearing for 6 weeks, which I didn't know what that meant at the time, but it led to really being quite depressed. But I went to physical therapy and discovered that once I learned how to help myself, I could be a completely different person. And I was able to really make a difference and see the difference that it made in my life when I was able to learn how to help myself. And during that time, talking to the physical therapist about being able to learn how to help myself again, he brought up the fact that they were opening a hospital, and I really learned for the first time what rehabilitation nursing was about, that nurses could be part of this practice that took a patient that had had an injury, much worse than mine. Mine was pretty simple, but injuries that were catastrophic in nature, and nurses were part of the team that could help that patient learn how to help themselves get better, help the family learn how to accommodate situations so they could have that patient back home and have a normal life. And I was hooked. And so as soon as my ankle was better and I could return to work as a nurse, I sought a position in a rehabilitation hospital, and the rest, as they say, is history. So I cannot imagine practicing nursing in any other setting other than rehabilitation. What we do is simply amazing. I have the privilege of working with rehabilitation hospitals all across our country, working with rehabilitation nurses, much like many of you that are members of our organization. And what you all do every day is just something that blows my mind, that we're able to impact people's lives on such a scale. And I think sometimes rehabilitation nurses don't stop and think about that and think about the benefits that you give patients, the numbers of people you put back home at the dinner table, and it is just so impressive and so rewarding. So you may wonder, why am I running for a second term on the board of directors? I've been on the board of directors for 3 years, and I really want to have a second term, have another 2 years on the board of directors, because I think we're just really starting to work on that strategic plan that we set in place back a few years ago, where we really kind of looked at those things that were going to be important to keep the organization moving forward. We have a great organization. It's been strategically very, very strong. And one of the things that we do as an organization is that we continue to set strategic goals every few years so that they don't get old and stale. And so our current strategic goals really kind of look at creating strategic partnerships. And that's something that I think has been a great benefit for us. We've done a few things that I know I've been a part of, and that's developing some institutional memberships where large organizations can have the ability to create a contract with ARN to be able to bring large groups of staff to the conference, as well as have some benefits for having memberships in a larger number of their employees. We also have developed a partnership with the Neuro Nurses Association, and then some other things that we've done as well that really kind of developed us in reaching out beyond our walls of just our own organization and seeing where we can partner with people that will strengthen our organization as a whole. We're also looking at engaging members, and one of the ways that we've done that this year is to really ask you, what do you want? What do you need? What are the things that we need to be doing as an organization to help those nurses that are at the bedside, those nurses that are doing research, those nurses that are doing performance improvement, those nurses that are in case management? What are the things that the membership of ARN needs us to be doing as a board? We're also trying to stay focused on those strategies and making sure that we are paying attention and listening to you as members and not just thinking about the way we've always done it. We're thinking about how you would want us to do that, and I think that's important, and that's something that I really want to continue to be a part of. Another piece that I think is really great about engaging our members is the focus this year that we've had on our diversity and equity and inclusion. And I think as we look at our membership, it is a very diverse membership. We have the benefit of being a national organization where we have members of all ethnicities, all across our organization. We have, if you come to the conference or if you sit on a call and you just hear the voices and see the faces, you know that we have a very inclusive organization that benefits from having all of those different viewpoints. We also look at increasing the visibility of ARN as being the leader in evidence-based practice for rehabilitation. We are rehabilitation. I don't understand why anyone else would consider themselves to be the leader in that. And so one of the things that I've come to find out is we're the best kept secret. So understanding that we need to get out there and make sure that people understand if they want to have information about evidence-based practice in rehabilitation, they might check ARN out as the source. And I think we have a little bit more to go on that, and I'd like to continue to help to work on that. And then the last strategic goal is really advancing the science of rehabilitation. We have some amazing nurses that are geared toward research in rehabilitation, and there's not that much out there. There's certainly more in the last 5 years than there has been. We still have a long way to go in really looking at the science of rehabilitation nursing. Being able to fund some of that research, fund some education along those lines is something that certainly fits within our strategic plan. I would certainly like your vote. I would love to sit on the board of directors for another couple of years and be able to help promote this fantastic practice of rehabilitation nursing. Thank you.